Okay, good morning, everyone. Before the Belzutifan session that is already there, I want to take a little bit of your time to talk about KCA. Some of the programs we're doing, the aim of this is to inform you about what we are creating in terms of support to patients, patient programs, but also resources that you can tap in, you can refer your patients to, you can use for daily practice, can help you, and also update you on some of the active research programs that we are planning to launch next year where you can participate. So, as I said, the learning objective is really to learn more about what we are doing at KCA. And when we trying to do something is never in isolation, like, what really testify in this room is a labor of collaboration. So in this slide, I want to highlight 4 of the major players that we're always trying to involve at some level. It could be like a one-on-one interaction, at some level is all stakeholders involved. Patients, patient organization, HCPs, you are in the room, and then, companies that are really kind of keeping the gates or, helping us get access to data that we learn from Peter is so important, but also industry, which is another key stakeholder. So let's go and look at the maybe patient organizations and what are we doing. I want to highlight 3 projects that we launched this year for our patient program. I'll start with the Clinical Trial Finder. This is a very simple tool that is on our website. Patients can actually go and look for clinical trials. It's categorized by subtypes, and we are already seeing a 2.0 version of this with improvements. But the key point is to simplify what the tool actually learned from clinicaltrials.gov. There are multiple ways and multiple iteration of this type of tool. We thought we have a good, simple tool that patients can refer to. The idea is learn more about what experimental therapies are available and then go back to your doctor, talk about them, what are the options. So if you want to direct your patients, this is a great tool. Another program that we are doing for patients that are willing to help is a collaboration, for instance, with one of our social collaborators, Immerman Angels. They have been doing mentorship programs that support patients, specifically cancer patients, and we are creating a program that is specific for kidney cancer. So we are recruiting, training through their program, and then deploying these mentors to help one-on-one patients into their journey. So it's really is focused support. It's almost like you have a buddy that will guide you through the experience that maybe this person already has recruiting, participating in the clinical trials or receiving a certain line of treatments, dealing with some side effects that could be very helpful for patients. The other program is our Caregiver Connections and Patient Perspective. These are monthly regular meetings that are peer-led. So we have caregivers, we have patients, and it's really a safe environment for patients and caregivers and families to participate and to share whatever they feel they want to share. It's a very candid discussion. It's on a regular basis, and like all of these type of supports are very well received by the community and very much needed. So we have those 2 programs. We had an initial, I think 6 months we're in. Response is great, but just want to make sure that you have that resource available and you can you can point your patients or anyone who is interested to know that these things exist. Other thing we're doing very briefly, we are developing, for instance, specific resources. For instance, we created one for financial resources, how cancer impact work, understanding, the employment laws, determine the right options for patients in their career during and after the diagnosis. I think was one of the things that, feedback that we got from patients to learn more. But also creating other type of, materials like, the symptoms, knowing the signs, and more of this is coming all the time. So if you have any feedback on something that we could use, This, we can create new things, but these are already available, and, you can download it. They're in different formats, digital, and also you can order, paper. Another thing that we've been doing also is trying to put out, important discoveries out into the public, make more knowledge of great discoveries that are being made that patients should be aware. This is a partnership we did with Christy Johnson's Foundation, and we target specifically exercise and sickle cell trait from the study from Pavlos at MD Anderson, where we actually, created a very lay, piece that explains this risk factor in a very simple language that is engaging and understandable by patients, and they can refer to. So we're going to push this more because I think it's going to be important for this specific population to understand about this risk. And we're going to planning to do more of, the great things that we're learning every day about kidney cancer. So here is an overview of, let's say, all of our affiliates program. Now we have 6 currently on, and the advocacy partner organization that we're working with on specific projects, like, the Immerman Angel that I mentioned before. Another very important piece that I want you all to be aware is our virtual patient symposium, which was very successful. We ran it in September, and there were these are lectures done by professionals with a target audience, of course, of patients, explaining what are, practical things like, understanding your pathology report, or, what happened, behind the walls of a tumor board when your tumor is discussed, when your case is discussed in a tumor board. But also other, session about nutrition or supportive care were very, very well received by the feedback that we received from patients. So we're planning to do more of this. All of the material is available on demand on our website. So if there is any of these topics that you want to refer to, just know that this is available on the website. Another program that started as, very 2 years ago at IKCS, but now has really matured into a full-fledged program is the Women in RCC. I want to highlight the first meeting we had officially for the program that now is a year-long program. In July, we had a very nice attendance, and we have also follow-up at this meeting. So I hope you also reserved your spot, because, you cannot walk in. You have, choose this. So for those who actually reserve their spots tomorrow morning at 6:30 in this room, we'll hear, about this group with, a guest speaker, Hannah Riley-Bowl from Harvard Kennedy School. And we also have other, meetings and activities that are stemming out of these discussions that are important for, the career, but the development of women in RCC in our community. So here is a QR code if you want to stay updated. We have a website, but you please do, because it's not only women, but this year we also have allies, and we want, to hear feedback and by the entire community. Another very important piece that we do every year is the KCA award program. Here you see the lineup of the awardees of this year. We were very pleased, and we awarded over $400,000 in grants. This year we had specific calls and support, in particular with specific affiliates and other organizations that supported specific topics. We want to go down the road of continuing this partnership with affiliates that are, passionate about bringing or keeping a line of research in a specific subtype, but also supporting, the general, research that is happening in kidney cancer. When we talk about access to data, here is a slide where you probably heard about the Data Federation project that KCA started exploring. It came out of an idea from a think tank 2 years ago. And the basic idea is very simple. How can we gather access to data in a safe way that, it doesn't break privacy, but is also secure and allow us to have access to quality data directly from the hospitals. So the federated learning practice is something that Array Insight, also known as SAIL, has on their capabilities to do. And we were exploring the way of federating different hospitals. The data never fly out of the firewall of the. So this is the beauty of the technology. But the data descriptors are able, with federated learning, to answer the questions and the queries that we want to do. So I analyzed this, the last 6 months I've been at KCA, and we're trying now to really break the single blocks that we need in order to kick this off. So the idea is to create 2 centers as a pilot for, a proof of concept. And the 2 centers are Vanderbilt and University of Wisconsin. If we can get this off the ground, we'll probably look at 2024 for an expansion to add more hospitals. Of course, the beauty of this is that the more we have, the better, because we get more access to data. In concomitance with that other initiative, we're also exploring other opportunities to access data. And nowadays, there are so many commercial options that give you access to real-world data or real-world evidence that are, claiming whatever, in terms of, capabilities, AI, quality, structure, anything. Here in this picture from this article, I just want to highlight how these systems normally work. Is a mix of getting, data from the electronic health records or other sources and then structure it in a structured or semi-structured way in order for systems to map them and then you reuse it. Of course, there's a lot of bias. There's a lot of, different vendors. So we are now in talks with companies and trying to see what is the best fit for, KCA, not just to have access to the data, but also to provide access to the data to the community. Concomitant to the data is also access to tissue, which is very important. I want to just put your attention here to a very recent announcement. We did a partnership with the Rare Cancer Research Foundation at Pattern.org. If you don't know, Pattern.org is an organization that allows for patients to participate in research, donate their excess fresh tumor tissue. They have already protocol in place with, shipping kits where they can be delivered directly into the operating room and with patient consent, take part of this and ship to the investigator that's really requested the tissue. So the patients can actually say what they want their tumor tissue to be done with. So we are very excited by these options. We're going to include it in as an option for the PIs to include it in their KCA grant. So they can use that for, if they need access to fresh tissue. Last but not least, I would like to have here on my slide another very important piece of our collaborations. Everybody in this room is probably representative of one of these companies. We need industry. We need companies that can actually cross and take those treatments to the patients. Their commercial capabilities, their scalability, research is great, but without industry, we couldn't really bring those to the patients. So thank you all, and I'm really excited by the breadth of different players, and each one of you brings something important because, of course, we're all driven by the fact that we want to bring new treatment, new therapies to patients, and better quality of life for all kidney cancer patients. So with that, thank you so much. I hope you learned something, and I'm here for questions.